Hello my dear friends and welcome to StudyIQ. I am Joycey Joy and today in this lecture we will discuss about the primary healthcare lessons from Kerala. What the Kerala model of providing primary healthcare has to provide for the rest of the country. What model does Kerala provide? Now let us come to the current affair first. Universal healthcare is one among the sustainable development goals and it has to be achieved by the year 2030. So proper systems in universal primary healthcare are very crucial in India if we need to achieve universal health coverage. So under universal health coverage, primary healthcare plays a very significant role. Now the experience of Kerala in transforming primary care has lessons for the whole country in achieving the Astana Declaration goals. So in this context, we will discuss about the Kerala model of providing primary healthcare. Now let us see what is Astana Declaration. In the month of October 2018 at Astana, Kazakhstan, the world leaders declared their commitment to primary care. So Astana Declaration is related to primary health care. Please remember this concept. There are chances that such type of questions can be asked in your UPSC preliminary examination. So the examiner can ask you what is Astana Declaration related to and they can give you 4 options. So the correct option is primary health care. So in October 2018 at Astana, Kazakhstan, world leaders declared their commitment to primary health care and that is called Astana Declaration. And the Astana Declaration aims to meet all people's health needs across the life course. And this is met through a comprehensive, preventive, promotive, curative, rehabilitative and palliative care. So it is comprehensive and holistic in nature. And under the Astana Declaration, a representative list of primary care services are provided, which includes vaccinations, screening, prevention, control and management of non-communicable and communicable diseases, care and services that promote, maintain and improve the maternal, newborn child and also adolescent health. It also includes mental health and also sexual and reproductive health. So this is in brief about Astana Declaration. Now coming to Kerala's experience or Kerala model in this regard. The Kerala government has adopted Ardram mission. So Ardram mission or compassionate mission in Kerala aims at creating people-friendly health delivery system in the state. So this mission is aimed at providing people-friendly health services or health delivery system in the state. And this is rather a need-based approach. And it aims at treating every patient with dignity. And in the year 2016, Kerala had, as a part of this Ardram mission, attempted to redesign its primary health care. And as a part of it, Kerala revamped primary care and Kerala tried to provide the services which are enlisted in the Astana Declaration to the patients or to the population in the state. And the Kerala government found out that these services, that means those services listed in the Astana list, this cannot be provided without adequate human resources. So human resources had a key role to play in order to implement the Astana Declaration. And the current norm of one primary care team for a population is 1 for 30,000. That is the current ratio in India. So Kerala government found out that this could be highly ineffective. So what Kerala government tried, it tried to reduce the target population to 10,000. That means one core team for 10,000 population. And even then the Kerala government found out that this was not very effective. And one of the findings of this Ardram mission was that providing comprehensive primary care will require at least one core team for every 5,000 population. So at the national level, it is 1:30,000, but Kerala government adopted it as 1:10,000 under the Ardram mission. But it found out that if it has to be effective, it has to be 1:5,000. So what does it mean? It means that a 6-fold increase in the cost of manpower alone has to be made if Astana Declaration or if primary healthcare has to be improved in the country. Now based on the Kerala's experience, let us understand what are the needs in the primary healthcare in the country. First one is fund. From the Kerala experience, we have seen that the ratio should be at least 1:5,000. And if it has to be more effective, it should be 1:2500. So this itself means that there is an increased cost for human resources itself. So this increased cost of human resources has to be coupled with many other cost escalations. For example, the supply of drugs, consumables, equipment, space, etc. So the cost of providing better primary health care would be very high. So this has to be funded properly. So the commitment to provide a comprehensive primary health care will be meaningful only with a substantial increase in the fund allocation. So if the government does not allocate more fund for the primary health care, plans or commitments to provide comprehensive primary care will not be meaningful or significant. Now the second important component is the training. Now, in order to provide better primary healthcare services, the medical and the nursing staff or the graduates should be given specialized training. And the postgraduate course in family medicine, this is the nearest course India has with regard to family medicine. This course is available only in a very few medical institutions in the country. So this has to be addressed. And Kerala has shown a model how they have addressed this issue. Kerala has addressed this challenge through short-term courses in specific areas. So such type of short-term courses can be initiated by other states and the union government also. An example is the management of diabetes, hypertension, chronic obstructive pulmonary disease and depression. So for all these short-term courses were designed by the state. So India has to build its capacity in this regard if it has to offer services as planned in many other states. Another component is the data. Access to longitudinal data on individuals will be helpful in achieving the link. We have discussed about the medical team population ratio. So proper data will help in providing the link. And for that, dynamic electronic health records can be maintained and decision support through analysis of data are also essential. Now the next component is the role of private sector. In India, more than 60% of the primary care is provided by the private sector alone. And the private sector provides primary care in most countries, but in many of the countries it is provided from the budget or from the insurance. But in case of India, the out-of-pocket expenditure is very high. And in case of India, the primary sector provides quality healthcare, especially in the primary care. And the private sector also invests in developing the needed capacities in medical field. So government has to focus more on fund management through various insurance schemes or incentives, etc. Now let us look into a UPSC Mains model question. The question is, health and wellness centers as envisaged in Ayushman Bharat will play a key role in strengthening the primary health care in India. So discuss. This is the question. Now, I will give you a brief guideline or an outline for this question. Please try to attempt this question and you can send me the answers to joyce.studyiq@gmail.com. So, I will give you a broad outline. Please try to answer this question. So, first of all, please explain why improving primary health care is important for the country. And secondly, explain the health and wellness centers under the Ayushman Bharat. How does it achieve the aim of enhancing primary health care, or how do they focus on strengthening the primary health care? So secondly, explain about health and wellness centers, and next explain what are the challenges in achieving primary health care or universal primary health care, and also give your suggestions on this, how to improve the situation. Now remember, the key word or the directive word here is discuss. So here you need to go through the details of the issues concerned by examining each of the issues. So here it is discussed. So you have to give for and also against. Both the sides needs to be discussed. So please try to attempt this question and you can send me your answers at joyce.studyiq@gmail.com. Thank you.